World Health Organization officially declares novel coronavirus crisis a global pandemic. On March 11, the World Health Organization announced that the novel coronavirus outbreak has turned into a pandemic. The agency reported that COVID-19 has been detected in every continent in the world except Antarctica. There have also been over 118,000 cases and over 4,000 deaths since the virus was first identified. WHO Director General Tedros Adhanom Ghebreyesus explained that they had never before seen a pandemic sparked by a coronavirus. He stressed, however, that the outbreak being labeled a pandemic does not change WHO's assessment of the threat posed by the virus. Pandemics are the worldwide spread of new diseases, while outbreaks are more cases of a disease than normal. Epidemics, on the other hand, are defined by WHO as more cases of an illness, health-related events, and specific health-related behavior than normal in a region or community. Before their latest announcement, WHO had called the novel coronavirus outbreak a public health emergency of international concern. WHO is now reportedly deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. Though the novel coronavirus outbreak is now a pandemic, WHO emphasized that every country can still change COVID-19 scores. Now that the world is dealing with a pandemic, countries will focus on mitigation instead of containment. Before WHO's announcement, governments around the world were struggling to contain the outbreak. Containment may have given them time to prepare to handle the disease, but it may have also already failed. Mitigation will deal with slowing down the spread of the virus in populations where the virus is already present. This could be done individually or collectively through measures such as frequent hand washing and social distancing. Social distancing includes the adaptation of work and study from home routines, closing of stores, and the cancellation of mass events, among others. A pandemic does not necessarily mean the cancellation of all air travel and nationwide quarantines. Using the term pandemic tells countries to work together to control the virus on a united front. Moderate to severe pandemics normally cost the world around $570 billion. This translates to 0.7% of the world's income, according to the World Bank. The SARS outbreak of 2002 to 2003 cost the global economy around $50 billion, even though it had infected only 8,000 people. COVID-19's mortality rate is lower than that of SARS, but experts believe it might be more damaging to the economy. The earliest pandemic dates back to 1580. According to the Centers of Disease Control and Prevention, 4 influenza pandemics were recorded in the 19th century, while 3 were recorded in the 20th century. The 1918 Spanish flu is considered the most severe pandemic in recent history, having infected around 500 million people and killing around 50 million worldwide. The last pandemic the world experienced was the novel influenza AH1N1 of 2009, first found in the US and traced back to swines. The pandemic killed between 151,700 to 575,400 in its first year, with 80% of the victims being younger than 65. WHO announced that the pandemic had ended in August 2010.